Hello everyone, this is Dr. Khan, Executive Plastic Surgery, Bloomfield Hills, Michigan. So as you will see, a very interesting case, pretty much a repeat of the one from yesterday. Nice lady, 58 years of age, has her saline implants in 2006. And so she's doing well overall, and this May of 2025, she ends up getting a mammogram, and she felt like what was an uncomfortable feeling. Mammogram gets done and it shows what is a ruptured left saline breast implant. And so as you will see, 100% total capsulectomy, 7, 10, 25, initials NR, and 58 in 2006, she got the saline implants. The rupture, she ended up doing her work. Now I removed quite a lot of skin to help with this pseudo lift, given her overall ptosis that she had. And truly, I would say she has done overall relatively very well. You can see some areas so thin, some areas thick. I'm very happy with how the whole dissection has gone. Minimal blood loss. All of the capsular tissue has been removed. The other thing I want to show, look at this implant that's basically ruptured, how it collapses on itself. Saline implants are like a water balloon, if you will. It's like you have a flat tire. It deflates completely. So you can see there's a big difference between the two. So as soon as I go in, you will see what is a 𝐬𝐮𝐻 270cc implant that she has had. And I'm going to go ahead and remove it. And as you will see, complete total capsule implant and all inflamed tissue removal. So there is some fluid around. So if I go like this, you can see this stickiness. That's your leaching of the silicone from the silicone shell of the saline implant. 270 𝐬𝐻, what appears to be overfilled. And you will see, look at this tissue right around how it was sitting. This is this ultra thin capsule. No matter how thin the capsule is, that tissue behind that fatty tissue is abnormal. And as I cut into it, you will see that has been harboring some of this, whatever this consistency. So in my practice, I remove all of it, so there is no confusion that this was, you do not want to leave the culprit behind. So as you will see, some areas so thin, you can see my blue glove, and you can see these, what are these small bands on the inside, and I'm very happy and content with how the whole dissection has gone. So I'm going to remove my sterile glove from the top, the blue one, and now I'm going to go to the green sterile glove underneath, because remember, I do not know what I'm going to find on the inside, and I'm going to cut this open. And as you will see, look at the way how the implant was sitting, and again, a lot of inflamed tissue. So I just want to show, look at the way how it has collapsed on itself. So it was sitting like this. And just like the case yesterday, some patients, doctors feel this and they feel like it's a mass. And now they're getting a workup, and no, it is these edges. So yesterday's was triangulated. This is kind of a 4-quad angulated one. And look at the way how it's folded up on itself. Now I'm going to go ahead and open it up. Apparently there is no fluid around this one, as opposed to yesterday that had 22 cc's of fluid. So this one has no fluid around. And I'm going to go ahead and see right here. So look at this fluid that's somewhat around it. And if I go like this, look at this. This is the underlying culprit. Now, I want to go ahead and assess and evaluate what is this fluid. And you will see it's extremely slippery. It's like slime. And this is the underlying culprit. So that all the bad tissue, inflamed tissue that was protecting it has been removed as well. So what I'm going to do here is it's your 𝐬𝐻 270. So you can see in the US, the implants have on the back the make, the model, sometimes lot number written down. And in this case, we can see the style that's written, the cc's, and 𝐬𝐻 270 ruptured left saline implant. So many patients, and we'll go over that. So you can see, look at the inflamed tissue. All of this tissue has been removed, and this will be sent to pathology. No masses, nothing that I saw that were part of the underlying culprit. And again, just to show you, this is the tissue that was around it was removed as well. So many patients asked me which one was easier, the right one, intact saline implant, or the left. Certainly the left ruptured implant was harder. And anytime the ruptured implant is always the harder one because I have to remove not only the implant capsule, plus all the inflamed tissue around. So just like always, this is the 𝐾𝐿 procedure. No need for a lift. Actually, she's done reasonably very well just on the OR table with how she's recoiled. With the weight of the implant, I was pulling the breast tissue down, gone. Between the excess skin removed and the pseudo lift and the internal sutures that were placed that lifted the breast tissue up. So no need for the unnecessary lift, no need for the unnecessary drains. Blood loss was 5 cc's or less. The implants will be returned to the patient. Capsules will be sent to pathology, rule out the rare VIAL-CL CD30 analysis, rule out lymphoma, rule out breast cancer, rule out any abnormal pathology, cultures for aerobic, anaerobic, and fungal. High definition pictures and videos of what you're seeing right now, and certainly what is on the chest wall, and not only pictures but videos of the chest wall showing complete removal of the capsule. So this is the take-home message. The surgeon must show high definition pictures and videos of the chest wall, complete removal of the capsule, and that's part A, and part B is what you're seeing here, cutting open of the capsule so that there is a complete, sincere removal of the capsule. Every surgeon should be doing the same surgery for all patients regardless of the comorbidities that the patient, so this patient got the same surgery as all my patients get, where all of the capsular tissue, inflamed tissue around, and the implant is removed as one system. There's 100% total capsulectomy, or en bloc, in this case 100% total capsulectomy. And so there is that complete confidence that all of the bad tissue is removed and that all of it is sent to pathology. So this is the 𝐾𝐿 procedure. There you have it. This is Dr. Khan, Executive Plastic Surgery.